Greetings, I'm the dentist. In our DENTAGENDA, we will be continuing the second chapter, Preventive and Community Dentistry. These are the points included in this chapter video series, and in this tutorial you will learn about plaque and tooth decay. In this video, you will learn about bacterial plaque and how it turns to calculus and the relation to tooth decay and other oral diseases. Starting with the nature of the dental bacterial plaque. Dental plaque is a structurally and functionally organized biofilm of microorganisms, mostly bacteria, but also fungi. It can form between teeth, on the buccal or labial, and palatal or lingual surfaces of teeth, on occlusal surfaces, supragingival or subgingival. Dental plaque is also known as microbial plaque, oral biofilm, dental biofilm, dental plaque biofilm, or bacterial plaque biofilm. Plaque attaches not just to tooth surfaces, but also to restorations and prosthetic appliances, including dentures and bridges if left undisturbed. Understanding the formation, composition, and characteristics of plaque helps in its control. The following diagram provides a detailed 6-step explanation of biofilm formation. Firstly, an acquired pellicle, which is a layer of saliva that is composed of mainly glycoproteins. It forms shortly after cleaning the teeth. Then, bacteria start to loosely bind to this pellicle. Then they proliferate and multiply and form microcolonies, which is step number 4. In these microcolonies, Streptococcus mutans use the enzyme glucansucrase to convert sucrose into a sticky, extracellular dextran-based polysaccharide protective slime layer. It allows the bacteria to cohere, forming plaque biofilm, and then they start to grow and mature in this biofilm. Different types of bacteria are normally present in the mouth. These bacteria, as well as leukocytes, including neutrophils, macrophages, and lymphocytes, all are part of the normal oral cavity and contribute to the individual's oral health. These microorganisms all occur naturally in the oral cavity, and they are normally harmless. However, failure to remove plaque by regular methods allow them to proliferate and thereby build in a thick layer, which can cause any of the various dental diseases for the host. Those microorganisms nearest the tooth surface typically obtain energy by fermenting dietary sucrose. During fermentation, they begin to produce acids. The bulk of microorganisms that form the biofilm are called Streptococcus mutans, and other anaerobes are present as well, though the precise composition of the biofilm varies by the location in the mouth. Approximately 80 to 90% of the plaque weight is water. The remaining 10 to 20% forms of 70% of the dry weight is bacteria, and the remaining 30% consists of polysaccharides and glycoproteins. The bacterial equilibrium position varies at different stages of formation, and here is a summary of the bacteria that may be present during the phases of plaque maturation. Firstly, the early biofilm. It primarily contains gram-positive cocci. Older biofilm, which is around 3 to 4 days, has increased numbers of filaments and fusiforms. 4 to 9 days plaque has more complex flora with rods and filamentous forms. 7 to 14 days undisturbed plaque inhibits Vibrio species, spirochetes, and more gram-negative organisms. Also, note that the bacteria in the dental plaque differs according to the position regarding the gingival. In the supragingival biofilm, it contains mostly aerobic bacteria, meaning that these bacteria need oxygen to survive. And if the plaque remains on the tooth surface for a longer period of time, anaerobic bacteria begin to grow in this plaque. And in the subgingival biofilm, it mostly contains anaerobic bacteria, meaning that these bacteria will only survive if there is no oxygen. And here is to the clinically interesting part, how to detect plaque buildups. There are two methods. The first one is to use disclosing gels or tablets, and the second method is the visual or the tactile detection of plaque. Method number 1, plaque disclosing gels or tablets. These allow plaque detection clinically. Disclosing agents contain dye that turns bright red to indicate plaque buildup. Tablets should be chewed on for approximately 1 minute, and these can be used as an educating tool to show patients the before and after plaque removal status of their teeth. Method number 2, the visual or tactile detection. Dental biofilm begins to form on the tooth only minutes after brushing. It can be difficult to see dental plaque on the hard tissue surfaces, however, it can be felt as a rough surface. It is often felt as a thick deposit that may be present as a yellow, tan, or brown stain. These deposits are commonly found on the teeth or dental appliances such as orthodontic brackets. The most common way of dental plaque is assessed is through dental assessment in the dental clinic, where dental instruments are able to scrub up some plaque. Now, let's see how the dental bacterial plaque can turn into calculus. Calculus, also known as tartar, is a hardened plaque. When the plaque is not effectively removed during your oral hygiene routine, minerals from your saliva combine and deposit in this plaque to develop tartar or calculus, which is the hard, solid form of plaque. Unlike plaque, calculus cannot be brushed away, and if left unremoved, the blocks can be dramatically large, leading to serious periodontal complications and even teeth loss. Now let's see the evidence of the bacteria role in dental plaque that can lead to tooth decay. In vitro, incubating teeth with plaque and sugar in saliva results in caries development. In animal experiments, germ-free rodents fed a cariogenic diet, but they didn't develop any caries. But following the introduction of Streptococcus mutans, caries occurs, which suggests its relation. And the evidence in clinical experiments shows that stringent removal of dental plaque decreases tooth decay in patients. A correlation has been found between the presence of Streptococcus mutans and caries. This is not surprising because this organism is acidophilic, and it can synthesize acid rapidly from sugar and produce a sticky extracellular polysaccharide that helps binding it to the tooth. However, caries can still develop in the absence of Streptococcus mutans, and its presence does not inevitably lead to decay. For example, root caries has been associated with Streptococcus salivarius and Actinomyces species. Lactobacillus species are also acidophilic and have been implicated in Pitts and Fisher caries. In addition, plaque prevents acid diffusing away from the enamel and hinders the neutralizing effect of salivary puffers. Now, after knowing the problem, let's learn about the methods of bacterial control to prevent caries caused by plaque accumulation. Dental plaque can be controlled by the physical removal, either by a professional or by the individual him or herself. By a professional, if sufficiently frequent, it can decrease caries, but it is impractical as a population-based approach. A person should have professional teeth cleaning at least twice a year. By the individual, the available evidence suggests that toothbrushing alone is not an effective method of caries control, and it should be accompanied with other methods of tooth cleaning. However, a long-term study has demonstrated much less oral disease, including dental caries, in patients who maintain good plaque control over many years, also decreases gingivitis. The second method to control dental plaque is the chemical plaque removal. To achieve more than a transitory effect, an antiseptic needs to be retained in the mouth. Chlorhexidine, a positively charged bactericidal and fungicidal antiseptic, is capable of this. It is attached to the negatively charged proteins on the surface of teeth and oral mucosa, and in saliva, from where it gradually leaches out. It is available as an 0.2% concentration mouthwash and a 1% concentration gel. Although the main application of chlorhexidine is in the management of gingivitis, it has been shown to be effective at decreasing caries when used regularly. While its widespread use for this purpose particularly is not practical, it can be helpful in the management of disabled patients or those with decreased salivary flow. Unwanted effects of chlorhexidine include staining of the teeth if used for a long time, disturbance of taste, and parotid swelling, which is reversible. It is less effective in the presence of a large buildup of plaque, so the plaque should be manually or physically removed first, and it is inactivated by the commercial toothpastes. Have you ever wondered if we can be immunized against dental caries? Well, here is the answer. As no vaccine is completely safe, the ethics of vaccinating against caries, which is an avoidable non-lethal disease, have been debated. Yet, despite considerable research and efforts to produce one, there is currently no such vaccine commercially available, and this may be due to a number of problems. One of them, and the most important, is which species of cariogenic organisms would you target, and whether the pathogenicity would then shift to another species. Also, the lack of economic interest. There is different modes of action in monkeys and rodents have been shown, and there would be a questionable relevance of experiments to the humans. Cross-reactivity to heart muscles in animal experiments have been shown as well. And the duration of the effect of this vaccine. Some patients may prefer caries to repeated injections of vaccination. To conclude, remember that oral hygiene, brushing, rinsing, and flossing, is important as dental biofilms may become acidic, and then they cause demineralization of teeth, also known as dental caries or tooth decay. Or dental biofilms could harden when the minerals from saliva deposit into the plaque, turning it into the hard solid form, which is calculus. Calculus cannot be removed through those methods, which is brushing, rinsing, or flossing. It can only be removed through professional cleaning. Thank you for watching. Don't forget to subscribe. I'd like to have you here for more videos. And follow us on Instagram at DENTAGENDA for extra tips and tricks.